Hi, my name is Jessie Malone, and this is the video for my NUR 433 Senior Capstone project. For Section 1, Implementation and Reflections of Community/Global Healthcare Concepts, I'm going to assess the community of Cumberland County, New Jersey. The reason I chose this community is because I was born and raised in it, and I went through my whole school career in this county too, so kindergarten through 12th grade. And then I went through Cumberland County College for my associate degree in nursing. And currently, Cumberland County College has the University Center where Wilmington University is affiliated with. So it's allowed me to soon obtain my BSN degree. So I contribute a lot of my educational success to this county, and I wanted to try to give back in a way by assessing the needs of the community and making a plan for action. And I also currently work in this community. I serve a lot of the community members because I work at the largest hospital within the community, which is Inspira Health Network. Cumberland County is situated along the Delaware Bay and conveniently located about 2 hours from New York City and Baltimore and about 45 minutes from Philadelphia and Atlantic City. It was founded in January 1748 and occupies about 500 square miles of land in the south-central part of New Jersey and has over 40 miles of Delaware Bay coastline. According to 2011 estimates from the U.S. Census Bureau, over 157,000 people call Cumberland County home. It's comprised of 3 cities, 10 townships, and 1 bureau. All this information I got from the Cumberland County, New Jersey's website, and that's dated 2016. I will show you a map, just kind of so you can get a feel of where Cumberland County is. So it's right near like Gloucester County, Burlington County. And so during my research, 2 community needs or two community characteristics that I identified were that there was poor overall health in the community as a whole. There's high incidence of obesity, which can lead to avoidable diseases like heart disease, type 2 diabetes, stroke, and certain types of cancers. Cumberland County ranks at the bottom of New Jersey's 21 counties for obesity, with over 30% of adults not participating in regular physical activity, and over 16% of preschoolers identified as obese. Another community characteristic that I identified was that there was a high unemployment rate. The county's unemployment rate is 13.3%. Nearly 4% higher than the state's rate of 9.5%. This can directly affect access to health care since most people receive health insurance coverage through their employer. So I'm going to show you a graph that kind of shows the people covered by insurance, the different types of insurances, and the state as a whole. So you'll see that the uninsured people in Cumberland County are 14.6%, and then uninsured people in the state as a whole is 12.6%. So it's definitely higher in Cumberland County, which is a fact that needs to be considered when formulating a plan. So 2 community needs and 1 community asset. To prepare to identify the community needs and assets, I tried to look at Healthy People 2020 social determinants of health. The 5 determinants of health that Healthy People 2020 identify are economic stability, education, social and community context, health and health care, and neighborhood and built environments. For Cumberland County, New Jersey, 3 of these determinants definitely stood out to me more, and those are economic stability, education, and health care. So these determinants will be intertwined within this video when I talk about the community needs and community asset explanation. So a community need that I identified was that education regarding non-communicable diseases and health monitoring and maintenance needs to be addressed. Tobacco use and obesity rates are high in Cumberland County, which are the leading cause of heart disease, stroke, lung issues, and certain cancers. I'll show you a graph that shows the rates of such diseases compared to those overall in the state of New Jersey. These diseases can be preventable, and with proper education regarding physical activity and healthy diet, the rates of these diseases may be able to drop significantly. So here's the graph that shows Cumberland County and the state as a whole. I think the top three are definitely ones that are needing to be looked at. The second community need that I identified was that available resources for health education need to be made known to the community. Cumberland County's educational level is pretty low. About 1 in 4 people do not obtain a high school diploma. So when you're educating this community, trying to consider and understand the fact that, most people don't go to college in this community and pretty much only have a high school level of education, that needs to be considered when you're teaching the community. I have a graph that shows educational attainment levels in the state as a whole and then Cumberland County. So this basically just shows, like I said, 1 in 4 people in the community do not obtain a high school diploma. So a community asset that I identified was that there's a large hospital within the community that's growing and partnering with larger hospitals to assist with the health of the community. And there is a growing number of urgent cares from this hospital network, which is Inspira Health Network, the hospital where I work. This hospital has 1 urgent care within the community, and then it has about 5 other urgent cares in neighboring communities. Also, the hospital wrote a 46-page summary identifying what the community needs are based on their research, and they're very proactive when it comes to addressing the needs of this community. So I think that that's a very large asset to have a hospital that is proactive and that wants to grow and expand and be better. So that's definitely an asset. Community needs diagnoses, I have 2. So the first one is increased risk for poor health among the community of Cumberland County, New Jersey, as demonstrated by low health ranking in the state. And also an increased potential risk for homelessness in Cumberland County, New Jersey, related to poverty as demonstrated by the low median income levels of this community. I have a graph here, the last graph I'll show you, which shows the poverty level in Cumberland County compared to the poverty level from the state as a whole. So that's pretty high. So the second diagnosis, the increased risk of homelessness, is definitely relevant. So a health plan that I chose for the diagnosis of the increased risk for poor health among the community of Cumberland County, New Jersey, as demonstrated by lowest health ranking in the state, would be explained next. Through the research to discover Cumberland County's needs, the largest stakeholder that I identified was the hospital within the community, which is Inspira Health Network. Like I said, they took the time to do a 46-page summary and identify the community's needs. They are a very proactive hospital and they seek to grow and better the community. So I think that this is definitely the largest stakeholder that I could identify for this community and addressing this need. The primary level prevention would be that the community health nurse would coordinate programs, services, and other activities to implement a plan of education on risks of smoking among the younger populations in Cumberland County, New Jersey. So education and counseling regarding smoking and the risks associated with it would go along with this primary level of prevention. For secondary level of prevention, the community health nurse can reduce the effects of COPD, diabetes, stroke, and cancer within Cumberland County by restoring individuals to their optimal level of functioning by providing education related to disease management and referrals to therapy. So things like screening for cervical cancer, dental exams, organized screening programs for communities such as health fairs on a regular basis would be key. And also making the screenings or the health fairs in places that are accessible to the community are important if you want them to be effective. So places like Walmart, places like the grocery store, places where people will go no matter what their poverty level or educational level. People have to get groceries. So making these screenings accessible is key if you want the screenings to actually be effective. And for tertiary level of prevention, the community health nurse can facilitate health screenings and community health fairs within the county to monitor diseases related to smoking, such as COPD, diabetes, stroke, and cancer. So teaching new clients with diabetes how to administer insulin or how to monitor their blood glucose levels, that all goes in with this tertiary level of prevention. Exercise therapy after stroke, dietary instructions related to diagnosis, group counseling related to diagnosis. That's also good because when you have a disease and you're newly diagnosed, you need support. And I think part of your support would be through these group counseling sessions. They can find peers that are also diagnosed with the same disease and find support, find, maybe they can learn some things from the peers. And home health care services for those chronically ill are also important to keep in mind in this level of prevention. How will I evaluate these? So for my primary level of evaluation, the best evaluation for this primary prevention level would be the use of informal question and answer, along with discussion and further education regarding topic areas identified by the learner. The educator can also use surveys to assist with finding a gap in the educational need of the community regarding smoking risk. For secondary level evaluation, we can evaluate the number of people who attended the screenings. Discussion with the learners during the screening is a great evaluation method too, and this will assess whether they will continue the screenings to prevent serious health complications. For tertiary level evaluation, return demonstration is one of the best evaluation methods. You can ask the learner how to demonstrate to you how to draw up insulin or check their blood glucose level, or also trying to find healthy plate options for meal planning on a day-to-day basis is also a helpful return demonstration for diseases like heart disease and diabetes. So return demonstration is definitely a great method to use for this tertiary level of evaluation. So moving on to section 2, it's connected learning for the review of literature, NUR 423, and the current course, NUR 433. So discuss at least 2 ways that you have connected your review of literature, community learning experience, and your community learning experience log work. For me, I'm really good at like book work and researching and writing, and it's another thing for me and a new challenge to put what I just researched into practice. So to me, the fact that I took so much time researching after school programs was my topic for my review of literature and their benefits on the youth members. It's really nice to see I spent a lot of time researching, and then now I'm spending a lot of time at the community learning experience site. And although I see similarities with what I researched and what I'm seeing, it's definitely a different experience to write about it and then actually take action and be in it. So the two ways that I have connected my review of literature, my community learning experience, and my log work would be like adults monitor children and adolescents at the Boys and Girls Club of Vineland, where my community learning experience is. And this is during the gap from the time school lets out to the time their parents get done work. I see that instead of being unsupervised and potentially getting into trouble, they're being supervised at the community learning experience site, and their homework is getting done. They're forming positive relationships with peers and mentors. During my review of literature, I researched extensively on the Boys and Girls Club of America and learned of the many different programs they offer. One of the biggest programs that stood out to me would be the Smart Girls group sessions held weekly at the Community Learning Experience site. It's a weekly session where the girls at the site get together for 45 minutes or an hour, or even sometimes take a field trip, which they're going to do a self-defense field trip, I believe this upcoming week, which is really it provides them with peers and mentors to talk about things that you may not want to talk with your parents about. So things that they talk about during their Smart Girls group would be self-respect, self-defense, like I just said, relationships, self-health, and more. It kind of made me envious that such a program existed, because I wish something like that was offered when I was growing up. It definitely provides the girls with a lot of support. And like I said, you may not want to talk to your parents about some things that you talk about in the Smart Girls group. Not that anything's a secret, but you just feel sometimes more comfortable with a female mentor that's not your mom, or your friends that might be a couple years older than you, who are going through the same thing. So that really stood out to me. So the culture of global health. Merriam-Webster defines culture as a way of thinking, behaving, or working that exists in a place or organization. Global health relates to the health of people at an international level. Health encompasses so many complex aspects. It's not just simply being disease-free. One of the resources that was offered in the template was from the Centers for Disease Control and Prevention. And it really stood out to me because they offered a great explanation of a healthy community. A healthy community is an appealing place to live, work, learn, worship, and play. And global health encompasses these same concepts. It satisfies the heart, mind, body, and soul. The culture of global health, therefore, seeks to provide everyone with the opportunity to function at his or her optimal level, both physically and mentally. Interestingly, through both my review of literature and spending time at my community learning experience site, I see how after-school programs like the Boys and Girls Club of Vineland is providing both physical fitness and mental well-being to the youth members involved. During my CLE site experience, the staff always tries to provide the opportunity for the youth members to play games inside, or if weather permitting, go outside. The physical activity benefits of after-school programs are definitely seen more in my community learning experience site than through my research. In terms of the youth's mental well-being, I saw the benefits of after-school programs both during my review of literature research and my community learning experience site. For instance, according to the Educational Broadcasting Corporation, children who participate in after-school programs behave better in school, have more developed social skills, and show more self-confidence as a result of the caring relationships they develop with staff and other students in the program. I definitely saw in my research a lot of the mental health well-beings of after-school programs, and I definitely see that during my site time. The physical activity, I really didn't see a lot of researched benefits of the physical activity of benefits of after school programs. That wasn't really focused on in the research, but I definitely see that during my site time. So, moving on to section 3, analysis and reflections about your continuous and cumulative learning experiences throughout your RN to BSN program of study. Consider your continuous and cumulative learning during your full RN BSN program of study, so general education courses, core nursing courses, and electives, and present 2 in-depth examples of your integrative learning experiences. How your BSN program courses have fit together or added to each other to contribute to your learning experiences. So example 1, I'm going to begin by explaining how my electives tied in well with my core nursing courses. I have to be honest that at first I was super frustrated with the fact that we had to take humanities and electives. Like, I just wondered why I couldn't take my core nursing classes and get done the BSN program quicker, because I already have been a nurse, I've been living, like, why do I need these silly humanities? But I definitely learned that this is part of being a well-rounded and intellectually BSN degreed individual and nurse. To best take care of others, I definitely needed to learn more about myself, and these humanity electives definitely showed me that. Courses like empowerment strategies, personal wellness, and building brain power grew me as a person. The courses provided excellent and interesting reading. I learned to take a moment to find what my core values were, and it allowed me to paint this mandala that I still have on the back of the doghouse in my backyard. When I look at the mandala that I painted from my heart, I get encouraged, and I hope that one day my future children will embrace their core values like I do now. These courses also taught me how to effectively communicate with others. They introduced me to things like TED Talks, which encouraged me in my daily life. These talks were given by very interesting people who've not had an easy life but have risen above it. The electives that I chose to take throughout this BSN course have molded me into a more mature and even a more spiritual person. I'm definitely more connected to myself because of these courses I took, and I'm better able to encourage my patients and my coworkers and even my family and friends to strive for their best. So I'm so happy now that I did take the humanities course and that I learned, there is a method to the madness, and I would gladly take these courses again because they were invaluable to me. Example 2, in terms of my core nursing courses and my BSN journey, I feel like they all fit together well. There wasn't really a specific order in which to take the classes, but I found that didn't really matter. They all built off of each other nicely. They had their repeated themes throughout the whole program. So nurses are professionals who are ethical leaders, and our role as teacher will always be present. Nurses need to strive to grow the profession and continue their education in some form. Learning is never ending. Even though the BSN classes had no clinical time because everybody's an RN working, I found that it did help me in my practice. The classes all had research papers, and these papers were topics that I chose. Because of this, I looked through many research articles that interested me and also affected my clinical practice. For example, nurse as teacher, I geared my teaching project towards new nurses and the ventilated patient. Through researching different videos and articles, I learned more about the ventilator functions myself, and it's still helpful in my day-to-day practice. There's student nurses who come through the intensive care unit, and I'm able to provide them with a lot of valuable information about the ventilator because it's super basic, but it's very understandable, and I contribute this project that I did to Wilmington University's Nurses Teacher class. And I'm definitely going to continue to use this teaching project that I made this summer when we have new hires or for the nurses that get pulled over to the ICU. They definitely appreciate the quick basic ventilator function that I can provide them. So the core nursing classes have helped me to grow as a nurse, and this experience to me is definitely priceless. So analyze your transition from basic RN to BSN level of nursing education. What's changed? How has your view of professional nursing changed? How has your perspective thinking about nursing roles such as clinician, educator, leader, resource, care case manager, consumer of research, collaborator, how has all that changed? And how do you plan to use your BSN nursing education? I have definitely grown as a nurse. This has been a 2.5-year journey for me to obtain the BSN degree. I became a nurse in 2009 at the age of 20. I waited 5 years before making the decision to return back to school, and there have been times that I have regretted not going to a 4-year school originally, but my thinking's definitely changed. If I did go to a 4-year school, I don't think that I would have respected the profession as much as I do now, and I believe that I would not have taken the classes as seriously. Waiting has allowed me to mature, and by taking the core nursing classes one at a time, that has allowed me to give more thoughtful insight to each assignment. Nursing is a profession, and it definitely deserves to be respected. I'm proud to be a nurse, and I am doubly proud to almost say that I'm a BSN degreed nurse. I believe that this profession should be a BSN degree because we work daily with people that have their master's and doctorate degree. So by taking the BSN classes, it's grown me intellectually, and this is important when working alongside other highly educated people. My perspective regarding all of the nursing roles of clinician, educator, leader, resource, care case manager, consumer of research, and collaborator have all changed tremendously. Now I see all of these roles as vital to the nurse. Before starting this journey, I thought that the role of clinician and educator were most important, but now I see all the roles as equally as important. The role of clinician is at the core of nursing and providing and carry out tasks for the patient is definitely what we do on a day-to-day basis. Role of educator is key for the nurse, and it's a never-ending task. The role of leader and resource were very hard for me to accept because I used to feel anything but a leader or a resource. One small example would be at work. My coworkers loved to make me resource. I dreaded the task until I took NUR 333 Nurses Leader. Since taking this course, I now embrace the role and see its value. I see that I actually do have a lot to offer in the role of resource, and it allows me to continue to grow as a nurse. Embracing challenges is key for me. Being a care case manager is essential for our patients. They look to the nurse for answers and to be able to provide them or link them in with someone who can provide them with answers. And that's rewarding to me. Consumer of research is something that I honestly am still struggling with, but I definitely see its value. Anything we do in this profession of nursing should be evidence-based practice. And I will continue to seek evidence-based practice once this BSN journey is done, because it's definitely important to provide optimal care to the patients. I work with intensivists, and they also value evidence-based practice, and that's encouraging for me because I know that because my coworkers value evidence-based practice, I will too. And lastly, the role of collaborator is essential. Working as a team is more effective for the patient than working alone. As nurses, we collaborate with many other professions such as physicians, other nurses, physical and occupational therapists, dietitians, and more. To be a collaborator with effective communication is invaluable to not only the patient but also the entire team. By obtaining my BSN degree, I have provided myself with much more opportunities. At this point in my career, I'm still not sure if I want to further my education, but I do plan to obtain my critical care certification. And I realize that learning is definitely endless, regardless if I return to school for my MSN or not. I love working in the intensive care unit, but by completing my BSN, I have allowed myself to be able to reach out to other hospitals or even into another field of nursing, be it outside the hospital. So quite simply, I don't know where my BSN degree will take me, but I know it's opened up many more opportunities for me. So select and describe an art form to depict your vision of professional community / global health nursing practice in the future, or verbalize your plan to continue your lifelong learning. I know I mentioned briefly about my mandala that I painted that represented my core values. By painting this, it provided me with therapy and peace. So my vision for the professional global health nursing practice would be a mandala of sorts that represents the world's optimal level of functioning in all aspects of the heart, mind, body, and soul. I'm not quite sure how this will look, but I do not feel like it would be pictures. I feel like it would be a beautiful combination of colors that represent each section, and it would form into something like a blooming flower. Through the help of nurses, this blooming flower with all of its colorful aspects would be able to stand strong through all the seasons of life. Its imperfections would provide stories and help the other flowers stand even stronger. And the flowers would stand strong even through life's treacherous seasons. This is my idea of the mandala for the professional global health nursing practice. As I have mentioned throughout this last section, learning is endless for nurses. This is true whether in school or not. The BSN journey has allowed me to see this fact, and for me, I know at this point in my career, I'm not going to go back for my MSN, but it doesn't mean that I will never go back. I really love what I do, and I see that my BSN will open up many more doors for me, either outside of the hospital or at another hospital. I definitely have options. I plan on becoming nationally certified by the fall of this year. Researching and truly finding more evidence-based practice for my daily life in the intensive care unit will never stop. Lifelong learning is definitely essential to grow as a nurse and continue to be a valuable part of the team. This BSN journey is one that I will value and I will never forget. Wilmington University has been a wonderful experience for me, and I can't thank you enough. So thank you, Wilmington University.